Thank you all for coming. What we're going to do today is focus a little bit on some of the current and ongoing research related to CLIMAS in terms of climate and health. CLIMAS actually has a pretty long history of doing climate and health related research, partially or maybe a lot thanks to Erika, who's actually in the room for us. Carried a lot of the portfolio of some of the early and ongoing work for CLIMAS in terms of climate and health. And what we thought today could be was a little bit of extending the pattern of the previous project showcases, which is just to let a couple of the different project teams who are doing ongoing work in terms of climate and health related research give an update on where they're at with some of their current projects and kind of where they see it going forward. Our first up, we'll have Heidi Brown and Erika Barrett talking about Vector. Then Greg Garfin and Sarah Leroy talking about some of the heat-related research in the El Paso Borderlands region, and then I'll talk a little bit more about an ongoing heat assessment and how that connects to some of the heat-related research going forward. So, thanks.
Thanks. So this should have the big words of draft written over it so that you get an idea, and I'll kind of touch on it, but what you're watching is an animation of vector abundance. So this is the number of mosquitoes progressing through time under two different climate scenarios. If your eyes are catching any difference in the two of them, you are amazing, because there's probably not any difference between the two of them because it's just the first few years. So you're actually looking at when they're quite similar. But you're watching mosquito abundance sort of progress through 1 year and then start back and move back around. I'll talk a little bit more about it when it gets there. For those of you that are proper GISers, yeah, it mortifies me as well. I realize that is a ridiculous timestamp, and I'm working on it. But that was quite frankly as far as I got in the time that I had to try to do it. We're still working on it and trying to get the longer time series and all sorts of fun stuff. Okay, the yellow arrows. So this is a swimming pool in. Thank you. This is just. Yeah, thanks. I don't do Max, they hate me. I'm surprised I actually managed to open that. This is a swimming pool in San Antonio. For those of you who embrace mosquitoes the way that I do, all of these are egg rafts of about between 100 and 300 shoeless eggs. Let me tell you, it's fun swimming in that pool. They should definitely clean up the pool and use mosquito dumps. But I think it's kind of fun to remind us of exactly where our mosquitoes are and where they're coming from. And sometimes it's your backyard and mosquitoes. So we're sort of the science side of the work that we're collaborating with ADHS, Arizona Department of Health Services. And that's kind of the pieces that we'll talk to you about of how we've kind of tried to get some of the science and that model that we were showing you and pulling it out so that ADHS can start using it and doing things with it. So the unspoken, unnamed collaborator here is Matthew Roach, who's up at ADHS. And this is primarily work that we've been doing with them for BRACE, the BRACE framework, building resilience against climate effects. Okay. I always forget what the E is because I want it to be extremes and it's not extremes. And it's a framework that was developed by the CDC to kind of walk your way all the way up to making climate adaptation plans and then evaluating the plans. And so the CDC has identified a bunch of states and a few cities that are specifically targeted to work on that. Arizona has one. And it's a neat way that they're doing the science, which is they have these communities of practice that meet via telephone and talk, and there's multiple different communities of practice that kind of collaborate across and talk about what all they're doing for BRACE. We're in sort of step 4 of BRACE in terms of how far the whole program has walked. But the first part was to look at vulnerabilities, and Margaret Wilder, who is not here, she helped us with that piece of it. And we're specifically looking at, because of our expertise, we're looking at vector-borne or infectious diseases and focusing, because we're Arizona, focusing on Arizona. And then the projecting, which is where we get to apply some of the science. And then what Erika will talk a bit more about is the public health interventions and moving those into the point of getting to adaptation plans. If you're interested, this one for sure is on the ADHS website, and these two should be coming up onto the ADHS website relatively soon. We're in semi-final draft of those, but those are the documents that have been produced. We're doing primarily infectious diseases here at Arizona, at the U of A, and ASU is primarily focusing on heat and some of the heat-related work in terms of the BRACE project. So like I said, we've made it through steps 1, 2, and 3, and we're kind of in the middle of 4. you have those. And this is some of the information that's available in those. I like this graph just because it's kind of reminds us of what the diseases are that we might be thinking about. And then also what the burden is here in Arizona, and to kind of remind us. So I finally updated my slide where this line is the Arizona population as percent of the total US population. And this is the percent of these diseases that are reported from Arizona of the total reported for the United States. And what you see is whether we want it or not, we own valley fever, which is of all of the ones, we're around about 60, 65, 70% of all of the cases. You'll see that given that we're about 2% of the United States, we're getting about 4 or 5% of West Nile virus cases. Plague is, so West Nile is vector-borne, and that's the one that we'll speak a lot about because that ends up being about 700 cases a year that we're thinking about. Valley fever is a soil-borne fungus. We're not doing a lot of that because it's really quite challenging in terms of trying to make those projections into the future of exactly what's driving it. We know that it's associated, but to nail down that association to the point that we can make a projection is, we're not quite there yet and willing to do it. And then plague and hantavirus, there's very small numbers, but when you consider the case fatality rates of, like Hanta is around 30%, even though they're small numbers, they're significant impact in terms of what's going on. So these are kind of the ones that we're thinking about, and they all have an association with climate that's been shown in the literature. So these are ours that we think about and focus on. That one. This is effectively what our when we think about trying to project and talk about West Nile and try to make an assumption about what that's going to look like in the future. These are our mosquitoes, and this is our model of them. So mosquitoes start as eggs. That was the egg raft that you were seeing. They then go through 4 larval stages, pupa, and then they emerge as adults. It's the adults that go, the adult females that go host seeking to get a blood meal to lay eggs and continue the process. So she's the one that we're most worried about with respect to West Nile virus. And so what the primarily, actually, it's kind of fun literature in the 50s and 60s. People put mosquitoes into incubators, turned it to a specific temperature, watched how fast they grow, documented all of that, and those are the data that we're then using to try to drive this model to look at, given that the temperature was this, how much of the mosquito development did it complete on a day, to be able to see how quickly it goes through its whole life cycle and starts to emerge as an adult. Which then is, I mean, if we believe that we can use those numbers, which we do, then we can start to make projections about, okay, given that the temperature is expected to be this is how many mosquitoes I can map. And that's what you were looking at in that first movie, is an animation of those projections across time. And mosquito, just that primarily is driven by temperature. So usually it's with the warmer it is, the faster it goes, up until certain thresholds. And then to a certain extent, depending upon the species that you're talking about, precipitation has an effect, both in terms of humidity that it pumps into the system, as well as created those places for the mosquitoes to lay eggs. You saw in the swimming pool, that's obviously not driven as much by rain, but other things are. This graph is kind of an interesting, oops, okay, I thought I had arrows. What you're looking at here is, I said, and really quickly, this stopped fast, relative humidity. And so what we found is that, especially for Aedes aegypti, which is the mosquito you're worried about with dengue and growing in what we're worried about, relative humidity, the blue line is the predictions, the orange line is the observed from, this is data from Puerto Rico. And what you see is that while we're catching the peaks pretty well, we're missing the length of that peak. And just by adding an adult survival on humidity, we were actually able to capture that a little bit more, which is kind of feeding back into that what the role precipitation is going to be. So we think we're doing a pretty good job about being able to capture it, and then we think that we can make those estimations about the future. And now we have a tool that we can start using. And then this is where it gets a little bit, this is where it's a little too academic. And we're hoping that at some point Allison's going to help us. And also we're kind of working to make sure that we put that better CLIMAS spin on it, which is to figure out what the stakeholders really want and what kind of information they want to be able to see and where it becomes operational. Which is, when do I go out and spray for vectors? How much do I have to plan for next year? These are the kind of decisions that need to be made. And how do we turn this information into something that they can actually start using to be able to make those predictions? So this is, current is in green, and future estimates, it's a generic species based on a generic location here in Arizona, but it gives some kind of idea of what it is, at least generally what we're expecting to see. So this is mosquito starting in January going through a year, and mosquito abundance increases and then it goes down, primarily driven, like we talked about, by temperature. But you'll notice two things in our future, which is we have this extension of the season. And we also have this interesting dip that we're seeing in some of the warmer places here in Arizona. So the extension of the season is particularly important in West Nile virus because that's the one that ramps up in the birds before it spills over into the humans. And so that's the one that we're kind of, that extra time is extra time for more mosquitoes to become infected and more mosquitoes to be kind of out there potentially, because mosquitoes are not instantaneously infected. And that sort of population of infected ones have to build up before we start seeing human cases. So this is a little bit disconcerting, but it's pretty consistent with what we see and what other people are predicting is happening with them. Interestingly, here in Arizona, we get, I said, most of the time we think about as the temperature increases, it goes faster, and then it hits a threshold where it's, believe it or not, too hot even for the mosquitoes. And so we see, especially in Maricopa, we see this decrease in the abundance of mosquitoes because it reaches a 40 C threshold and the adult females start to die and the populations crash. We're in the process of looking to see whether or not we're seeing, like, what does that mean for West Nile transmission? So you can imagine that maybe that's going to break the system such that you have either 2 peaks more West Nile, or that somehow it breaks the system and then you end up with fewer West Nile cases in the end. We need enough human cases to be able to look at that. So we took sort of this to vector control, and this is kind of a beginning of something that might be helpful in terms of, okay, when we're looking into the future, what's going to change, and then kind of what we're seeing in these higher elevations where we really just see the peak, and the peak doesn't change, we don't get that, we just see an extension of the season, but we don't see the midsummer dip. In Tucson and Florence, right now we're seeing the single arc, but in the future we might expect that to start dipping, so Florence will start to look a little bit more like Maricopa. And then right now, even now in the lower elevations, even vector control will say that they do kind of see this bimodal distribution in the abundance of mosquitoes when they're going out trapping. And so maybe that crash will become wider such that it actually does break the transmission cycle, and potentially they're almost trapping year round anyway, but it does kind of in terms of resources, making sure that resources get allocated to potentially having to do that in the future. Okay, good. This is my final slide, which is where we're also kind of, again, trying to capture those things that we know about vector control and to start getting the outputs to look like something that we can see and use. Again, I don't think that this is particularly well done in terms of operationalizing it, but it's also kind of interesting in doing. So those data that we watched the movie of, this is them over time plotted, and this happens to be for Douglas. So what you see here is that we don't get that midsummer dip until well out into the future, based on the predictions that we're having. What we're seeing here, you can sort of see that it's becoming wider. This is the beginning of the mosquito season once it reaches a threshold of a certain number of mosquitoes, and this is the end once there's no longer that many mosquitoes that are out there. And you're seeing that it's getting wider. So this means to vector control, as it gets out into the future, you're starting your season earlier and ending a little bit later. And then the top one is if say I know that in my traps when I see X number of mosquitoes, I can set a threshold, and this is the number of days that are above that threshold, which is again giving you an idea of how long they're going to be out there trapping mosquitoes. Not at the point particularly well showing those pieces of information, perhaps too much into the future, but that's kind of where we're working at from the academic side before we try to translate that into something perhaps more useful, which leads me to Erika.
Okay, so what you're looking at is the Arizona Climate and Health Adaptation Plan. This is the document that we that we published in March of this year. And it's a strategic plan for the state of Arizona that gives stakeholders and organizations a list of activities that they can use and integrate into their original activities that the organization is already doing to mitigate the health effects of climate change. This is a living document, and that each year we're going to be revising it and utilizing stakeholders to do the next version of the plan. So you can see at the top corner now we're getting into steps 4 and 5. So this is kind of the first step after we did steps 1 through 3 with the vulnerabilities and projections of where we're going with climate in the state. We're now moving into the interventions and adaptation planning. So the way that the state is tackling this is by giving seed grants, basically, or small grants to 3 different counties in Arizona. And we're working with 2 of them. The first one is Maricopa County. And I got to participate in their workshop, and they're calling it participatory strategic planning, which means you go to the meeting and you work solid for 5 hours and you're completely brain dead by the end. It's a great way to do it. They've come up with 5 key focus areas that they want to tackle with their strategic plan. So the first one is celebrating success in champions. So they're creating a climate change champion program where people can tell the state who's doing great things in Maricopa County, and then it's kind of a reward system for identifying people that are doing great things in climate change and health. The second one is coordinating research and collaborative efforts to catalyze change. And the output of that is a platform to share and coordinate efforts across Maricopa County and hopefully around the state by the end of the program. The third one is developing a strategic and targeted communication plan so they can share what's been done and also what they're doing in the future. Promoting community awareness and public education about climate and health. And they're doing this by tackling education curriculums in K through 12 schools. And so actually getting into the schools and figuring out what's being taught to the students and then changing it so that they're integrating more climate change curriculum. And then the last one is fostering environmental actions for a healthier community. And the output for that is a toolkit to encourage actionable items at the individual, community, and organizational level. So really taking the science that we've learned from the first steps and then making it into actionable items that people can do. All right, the second one that we've been working on is Pinal County. They're taking a completely different approach, which is, it's really nice to see that all of the counties, they're all kind of at different steps of the process. Maricopa County's done a lot of work on heat, and they're already at the step where they can do the interventions. Pinal County is actually just starting to get into the whole process of figuring out what they want to do for their adaptation plans. So they're at their surveillance step, or kind of the first, trying to figure out what's going on in their county. So their project is to utilize a syndromic surveillance platform called Essence, and they're using this to identify heat-related illness trends within their population, within their county. And the goal with that eventually is to utilize that same information and use it for vector-borne disease. So if they see increased numbers of West Nile virus or people going to the hospital for symptoms of that, then they can use that information to target key messages to populations. And yeah, okay. The next thing that we've been working on is the Climate and Health Hub for CLIMAS. Ben's going to be talking about this a little bit more, so I'm not going to talk too much about it, but basically it's a hub that's similar to the other websites on or tabs on the CLIMAS website that will have a brief description about what vector-borne disease or the certain health problem that we're talking about, a review of what's going on in Arizona and New Mexico, and then what health-related projects are working on and what the state of the science is basically at that point. We've already completed the vector-borne disease one, and the air quality and respiratory conditions is kind of under review, and then we also have extreme heat and then disasters like wildfires and flooding. So there's kind of this intersection with the 2 projects with Briggs and CLIMAS, and utilizing the funding that we'll be getting from CLIMAS in the future, which I'll talk about next, and with the current Briggs funding that we have. So the first version of the Arizona Climate and Health Adaptation Plan was developed based off of steps 1 through 3, but the second version, we really want to integrate stakeholders into reviewing the document and revising it. So during the annual review, we're going to be utilizing stakeholders that we've identified through stakeholder mapping and using those key stakeholders to utilize their expertise for review and making sure that the document is community developed and it includes things that can actually be actionable for decision makers and policy makers, and so that they can actually utilize the document in the way that it's supposed to be, the way that's useful most for them. And finally, I just wanted to talk about the project through CLIMAS that were funded through the RISA grant and or the funding. And it's going to be in years 3 through 5. We have kind of 3 major themes, and I kind of wanted to talk about the actions that we're doing rather than the theory and the methods, because I think it'll be better. So we've already started on mapping stakeholders. We have a list of about 300 or 400 stakeholders. That database will eventually be available for CLIMAS people in the group so that they can identify people that they should be working with or work with in the future. So we're going to be continuing that mapping and the roles that they're doing in climate and health adaptation plans in year 3. And then in years 4 and 5, we're going to be evaluating the impact of translating climate science to health. And we're going to be using the expertise of the people in the room here to help us do that evaluation in the best way. To get to that step, we'll be doing key informant interviews, focus groups, and workshops, and online questionnaire to identify how health officials are currently utilizing the documents that have been sent out by the state, and how to best disseminate that information in a useful way so that people can actually do actionable items with it. Okay, and that's the end. This is our contact information for Heidi and I. And if you have any questions, we're happy to answer them. Yes.
I think I have a question for Heidi, maybe more than for Erika, about the bimodal distribution.
Yeah.
So do we know now? Is it an artifact of the model, or have we seen it experimentally? But can we go into an entomology lab and demonstrate that actually happens?
So it started in an entomology lab, which is you put mosquitoes at high temperatures and they start to fail and die. And so that's what then the model is working off, which is those basic science experiments. What's interesting is that it's corroborated by vector control data, like observed actual data.
In Maricopa.
In Maricopa, yeah. I don't have those data from you, but the problem, if I can say that, is that vector control doesn't do vector control for science. Vector control does it to show the impact of vector control. And so getting long-term good data sets in terms of that, I mean, that's actually one of the biggest things that the model can do, is make those predictions. We don't have, like on that movie, we don't have vector control data for all those places. So I can simulate it for a place that doesn't have vector control at that level, and we can sort of identify it.
So we know the dip happens, we just don't know what happened as a result of the dip happening.
Right, so we have, that's a problem of, sorry, it's my world if I'm speaking about it backwards, but we haven't had West Nile here for all that long in terms of getting a long enough time series, and we don't get a whole lot of cases that get reported that we can actually map. So Maricopa, I'm looking at, I now have about, I think we have like 10 years worth of data that we can finally start mapping and trying to look at, and it does seem to have that dip, but then we get into low numbers and the stats of those kind of data are iffy. But that's what we're struggling with right now. It seems, at least in my eye, that we are seeing that kind of a little bit of a dip. What is interesting is that we're seeing the same thing. Human cases are starting earlier, lasting longer, and there is a little bit of a dip in Maricopa, but all in all, it's actually more cases.
So you're getting both parts of the bimodal. It's happening again.
Yeah, we're seeing it, yeah.
Which
is that same sort of fluctuation. But that's totally draft.
Time for one more quick one.
When we started on this work a long time ago, it was sort of a one species at a time thing, and one of the big critiques is, well, is there going to be substitution of species? And have you, playing with other parameters, have you seen whether or not you would actually have other species that would step into the 40° C threshold or some other part of the...
40 degrees seems to kill them all.
All right, so 80s is not going to, unless it's evolutionary, 80s is not going there.
Yeah. I think that like is truly like a biological max, where they're maxing out. You see a little bit of difference, so QLEX versus 80s, in terms of the other side of it, that cooler side of it. But even in that, once you get 10 degrees, we're starting to kill them off in the other We've not looked at an interplay of whether albopictus is gonna move in or something like that.
Yes, cool, but
Yeah, not yet.
not sure how yet.
Yeah.